I have heard that the preventive measures that have been put in place to prevent outbreaks have had negative impacts on the quality of life for many residents. Both of these, outbreak prevention and quality of life, are really important, and as we learn to live with COVID, we need to continue to make adjustments. Today I want to talk about new public health orders that amend existing directives for these kinds of facilities. These orders are designed to ensure continued protection of residents in continuing care facilities, as well as improving their quality of life. First of all, in these facilities, anyone with the mildest symptoms, such as a hoarse voice or muscle aches, must immediately be tested for COVID-19 and isolated until results come back. In addition, as soon as a COVID-19 case is identified, all residents in the same unit are now tested, even if they are feeling fine and show no symptoms. This has been a recommendation for several weeks, and it is now incorporated into the order to underline the importance of early diagnosis in close contacts in this population. Although testing someone without symptoms is only a snapshot in time and does not stop the need to isolate for 14 days in close contacts of confirmed cases, it can help to identify cases before symptoms start, helping to better control an outbreak. To protect the health of workers, any staff member caring for an isolated resident must also wear eye protection, along with all other appropriate personal protective equipment, including a gown, mask, visor, and gloves. Other measures still remain in place, such as requiring all staff to wear masks through the duration of their shifts in all of these facilities, as well as requiring workers in long-term care and designated supportive living facilities to work at only one location. The measures we have put in place over these last weeks are necessary to protect those in long-term care and other facilities. But I also know they are causing many residents to feel further isolation. This is something that I think about often, and I have heard people's stories. Maintaining connections with family and friends is paramount during the pandemic, especially for residents in continuing care and licensed supportive living settings. To help improve residents' quality of life, as well as recognizing that orders for continuing care facilities may need to be in place for some time, I am issuing a second new order. It will allow residents of these facilities who are not in isolation to enjoy outdoor visits with a designated essential visitor and one other person. These are important to the mental health of residents and families. Of course, even while outside, all appropriate precautions must be taken to prevent exposure to COVID-19. This includes physical distancing and requiring all visitors to wear a mask or face covering. I want to emphasize that restricting visitors into these facilities continues to be necessary to protect the long-term safety of staff, residents, and visitors, especially in facilities with a confirmed outbreak. However, there have been a number of examples where this policy has been applied in a more restrictive way than was intended, particularly for palliative and end-of-life visitation. We expect that individuals who are dying should have the opportunity to have their loved ones at their side, while following the guidance in place to ensure everyone's safety. That is why the orders that I'm announcing today also clarify visitation for circumstances where an Albertan is at the end of their life. The definition of end of life is in the 2 weeks prior to death, acknowledging that these estimates will always be imprecise. It is important, though, that it be clear that end of life is being measured in weeks rather than in days or in hours. Also, up to 2 visitors at a time will be allowed to visit a patient who is dying, as long as physical distancing can be maintained between the visitors. Finally, it should be clarified that standalone hospice facilities are not affected by these orders, and no visitor restrictions are applicable to hospice settings. Based on 5,205 new test results over the last 24 hours, we have confirmed an additional 315 cases, bringing the total in Alberta to 5,165. I'm pleased to report the number of recovered cases in Alberta has now reached 1,953. Sadly, we have also confirmed 7 additional deaths. This means there have now been 87 deaths in our province. All 7 deaths reported today come from long-term care facilities in Calgary, including 6 at Clifton Manor. I want to emphasize that this sad news is not a reflection of the work that has gone into managing this outbreak at the site, where my local colleagues tell me that the site responded promptly, created an isolation ward, and worked hard to prevent the spread. Despite this shows the power of this virus in a closed environment. My sympathy goes out to the friends and families of all these individuals and all those who live and work at Clifton Manor and any other site that is experiencing and dealing with an outbreak right now. I know outbreaks continue to be a concern for many Albertans. They are for me as well. I want to assure you that we have a comprehensive strategy in place, and aggressive outbreak measures are being implemented across the province, from prevention to outbreak response. This will be a cornerstone of our ability to live with COVID for the foreseeable future, our ability to work together to prevent rapid spread in all settings, but particularly in those that are at the highest risk.